has already been credited with saving a life of a convention goer at that location, and that was just since last August. So it is wonderful to have these 39 additional defibrillators to bring our total across the city to 201 at the different facilities around the city. And again, TGH donated $500,000, as I said, to equip every patrol car with one of these life-saving pieces of equipment. So this type of community partnership really defines our city. Whenever there's something to celebrate, we come together to celebrate, but also we come together when there are issues to be addressed. And this is an issue of utmost importance because it literally can save lives in our community. Now, the one use that I know hasn't been thought of yet by the American Heart Association or Tampa General, but I personally have thought of this. We can actually, some of these are portable and they can be checked out for events. So I think that we're probably going to have to take a number of them to all of our Tampa Bay Buccaneers games, because if I tell you what, if the team keeps finishing the way that they do and Baker Mayfield makes our hearts race the way that they do at the end of the games, we may have to use these. But if Baker would do us a favor, give us a little more leeway with the scores at the end of the game, I think everybody at the stadium will be safe. So now it is my honor to call up Courtney Burt from the American Heart Association.
Good afternoon, everyone. I am so grateful to be here. My name is Courtney Burt. I'm the Vice President of Community Impact for the Tampa Bay American Heart Association. Like Mayor Castor said, there's 350,000 individuals that have an out-of-hospital cardiac arrest. The sobering statistic is that less than 10% of those individuals nationally will survive that event. What evidence shows is that quick bystander intervention with CPR and the AEDs help bring that survival odd up tremendously. Today is October 14th, and it happens to be Sudden Cardiac Arrest Awareness Month. So what better time for us all to get together and raise awareness about learning a skill called hands-only CPR. I heavily encourage everyone that's tuning in to please take a moment, go to heart.org and learn how to perform this skill. You can literally learn it within minutes and teach your entire household the importance, the ease of how to learn this life-saving skill. Only about 4 months ago, we were at the Skyway Sports Complex celebrating our first of 27 public access AEDs. These devices cannot be made possible without supporters coming alongside us. And one of our really amazing community collaborators is actually here in the audience representing Florida Blue, and that's Phil Lee, the market president here. They were really the first to come alongside us in this campaign of getting public access AEDs. We had installed over 100 devices in Hillsborough County with little leagues and sports and recreation complexes. But unless these devices are accessible 24/7, then we really don't start to move the dial. So we can't thank all of our partners. Florida Blue and now Tampa General is coming alongside us. They're going to be installing over 10 of these public access AEDs over the next year. And then we hope to just continue to grow this across Tampa Bay. The way the American Heart Association also brings this work forward is we are training across all sectors how to do hands-only CPR in our schools, our workplaces, anywhere people come together and live and congregate. We need to get as many people as possible empowered with these skills, and we're going to see those numbers come up. The American Heart Association has a goal of doubling out-of-hospital cardiac arrest survival by 2030, and with these partnerships and these collaborations, funding to get kits like this going home with every single community member across Tampa Bay, we're going to start seeing lots of lives saved. So I can't thank you all enough, and it's my pleasure to introduce Dr. Dumitru, who will tell why these interventions are so important when it goes to transferring to a clinical setting.
Good afternoon. My name is Ioana Dumitru. I'm a heart failure cardiologist with Tampa General Hospital. And I have the privilege to be here today with Mayor Jane and American Heart, as well as Tampa Safety, to celebrate this very important event of having public access to life-saving interventions. Tampa General is deeply committed to provide state-of-the-art care, excellence, and compassionate interventions to their residents, not only within the hospital space, but as well as outside the hospital space in the community. The partnership with American Heart Association in terms of providing AEDs to public spaces and the community saves lives. Every minute counts, not only for bystander CPR that is efficient, but also by providing appropriate and timely reestablishing of the heartbeat, as well as the blood flow to the brain and to the rest of the organs. We improve survival to 70%. This is unheard of, and every public space should have access to timely interventions. So thank you so much for all the collaboration, and we're looking forward to continue this in our Tampa Bay region and Tampa City. And with this, I will have Mr. Larry Frassard, City of Tampa Safety Training Specialist, say a few words. Thank you.
Thank you, Doctor, and thank you to Mayor Castor and Courtney. We started out the public access to defibrillators in 2005. We started with 13 defibrillators. We are now up to 201 defibrillators spread throughout the city. We do a tremendous amount of CPR training with our city employees. And the unfortunate thing is that 199 of the 201 defibrillators are indoors. So with the grant through American Heart Association, money was donated to Friends of Tampa Parks and Recreation, and in turn, that money was spent to allow us to buy 37 additional defibrillators. So our intention is to install as many defibrillators as we can in outdoor boxes that you can see behind me, with instructions that the caller is to dial 911. Once they get the 911 operator on the phone, the 911 operator will send Tampa Fire Rescue to the location that is on the instruction sheet above the cabinet, and the 911 operator will then give the caller a 5-digit code to access the defibrillator and actually open the defibrillator box, retrieve the defibrillator, and put it into use. If we can get this done, if you can use a defibrillator on a cardiac arrest patient within the first 3 minutes of the person going into cardiac arrest, it greatly increases the chance of survival. So the more of these defibrillators that we can get for true public access out in parks, at recreation and sports complexes throughout the city, there's just that much better chance of saving someone who has gone into cardiac